Mohawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID 19. Thank you for liking, subscribing, and sharing our show. Thank you for being a part of the show and supporting the show. We have interviewed many people, people who are supporting behind the scene, people who are in front line, people actually supporting small businesses around the different states in the United States. I'm so excited to bring today somebody from Aapi who's also helping in their own ways to support this fight. I have Dr. Lokesh Edara from Aapi, who's the chairman of International Medical Education. Good evening, Dr. Lokesh.
Good evening, Sheffield. Thank you for having me. I really appreciate this opportunity to share with you my views with your audience.
Thank you so much, Dr. Lokesh, and thank you. It's a great honor to have you. So, tell me a little bit about you and the work you do at Aapi, a little bit about your background.
Yeah. This is Lokesh Edara. I'm practicing allergy immunology for last 30 years in Battle Creek, Michigan. I'm a board certified internal medicine and allergy immunology. I'm also assistant professor at our Western Michigan School of Medicine in Kalamazoo. I'm a past president of Michigan Allergy Asthma Society. I did 3 years as a foundation chairman for Telugu Association of North America. We did a lot of charity work back in India, including eye camps, etc. Currently, for last 2 3 years in Aapi, I'm working different roles. My main goal is all MBBS students, all doctors and nurses should graduate equal to students here in the United States. There are some gaps. We're trying to fill up the gaps so that every small rural village nurse or doctor should be able to graduate with equal confidence. That's my main goal. Since the COVID came, we started working with Aapi.
Yeah. So, this is a wonderful goal, first of all, to try to have equal education, both just like United States and America. Thank you for doing that and in leading that initiative because it's very important. Tell me a little bit about what you have been doing in COVID, in terms of supporting API and other physicians.
Thank you for asking them. COVID suddenly it came in March. We're
Yeah.
not aware of it, and it is when we look at history, we're all going and learning the Spanish flu in 1918,
Yeah.
and the lungs looks like autopsy lungs looks like in the Spanish flu, similar to they have a World War I going on at the time, and
Yeah.
they have used a mustard gas, and the autopsy showed grasp things is equal to burns, chemical burns, and here.
Hmm.
So people in COVID, as we learned last 2 3 months, we learned it is more of a our body inflammation, which is we're losing people, not the virus. So
Okay.
the, so how did we start the journey? We working with CPR in India with emergency physician, one of them, Dr. Arunachalam. He's
Mhm.
in Washington, Seattle, and he's the front at that epicenter start in our country. And
Mhm.
I'm talking to him, learning more and more. Then, when it comes to other places, we start through API, and we don't even have a Zoom at the time. We subscribe it, and then we
Sure.
started talking with Dr. Arnachalam and also infectious disease specialist Dr. Deepa Madam. And then, since then, we are conducting Zoom meetings and learning each other. We invited pulmonologists, infectious disease. Today, actually, as we speak, half an hour from the infectious epidemiologist coming from across the board from India, and who himself said we cannot run to moon. We have to deal with. So that's what we're learning about and passing through that. In Aapi, we did a few historical things. Once we know Bay Area is the first city to lock down, so we learned that that's the way to do. And then we wrote through Aapi, take a stance. We requested to everyone, including governors and president, lockdown is a must. But unfortunately, our country, USA, is a more republic, and it has
Yeah.
more states have control. So I
Mhm.
came to know that late. And so countries like Germany or Korea or India were able to do executive well. And the first phase they did astonishingly well. So our numbers in India is much better because we were able to do the first phase really well.
Yeah.
Then we moved on to mask. We learned that the virus is coming from the mouth.
Yeah.
So by talking, it's in the air for 3 hours. Then if you wear the mask, I'm not able to spread my virus if I'm asymptomatic. We found that a lot of people in Iceland studies, we found that 50% may be asymptomatic. So we campaigned, through API, we endorsed that everybody should wear a mask. We requested letters to governors and everything. Even we wrote a letter to the governor of Michigan, and I talked to senators in our state. And my city, Battle Creek, Calhoun County, we made a law even before everybody,
Wow.
and they already respected that they send the letter to all the businesses here.
Mhm.
So that's why we once we found out with Aapi, the platform, we were able to communicate through to our wish. That's all we can do. We can keep on requesting and present the data. So,
So, in your medical education, so you said that you figured out and you tried to talk to senators, your state, and others to try to wear the mask. What are the other steps? I mean, you gave a very good comparison with Spanish flu, and it's kind of not similar, but kind of similar if you look at those old days and pictures, social distancing and things like that. How did you, as a leader in API, was able to educate your team and other physicians how to follow that? What are the next steps?
in Alpi, the shake the mask. We made a team effort. We there at that time there is no mask, and so we have a lot of people who are making masks. We learned the technology from the scratch, and we have a lot of volunteers stretching. We donated to our cloth mask. We made a campaign so that. But eventually, it's amazing once the America rises. If the challenges, everybody is teaching us. My nurses bringing their own, and it will within about 24 hours, 48 hours, and America is ready with the plan. So that's not issue anymore. If I go to Myers at the time, my grocery store, only 10% wear. But now everyone wearing a mask, and then when also I came to learn that there is a opaque sheet between the teller and us, so that so we don't spread each other. Like in our own office, we have those sheets. We made that so receptionists will be protected, and so we can able to flat the curve. So that is way taken up across the country very well.
So,
And then CDC is behind it actually.
yeah. Tell me, you brought up a great point. People talk about this flattening the curve. Can you explain what that means to our audience?
Yes, actually, what we learned, most of the epidemiologists, most of them say, they say if it is follow the same path of Spanish flu, there's R naught. R naught means it's 2 or 3, the infectivity rate. So they expect this will stop only 50 to 60% of the us get infected, then only it will stop. So then we can ask why not everybody get it over with the 2 months? But if that happens, the casualty is too much. Our
Yeah.
health system will break. So by lockdown, we're going to have lesser case but a longer term.
Yeah.
And for example, you look at the Swedish model where they let it go. They did not shut down much. They did take precautions. And now I learned 7% of them got infected only. But they still have 50% long way to go. But still, that's one way of approach. That's what I'm concerned about. How to treat them, how to inflammation.
So, the people talk about this inflammation as a cytokine, really, storm, and you being in the infectious and understanding allergy. Can you explain what that means?
Absolutely. What we learned is because COVID is infectious, so we're staying away in our outpatients. But what we know as an allergist for last 50 years, we treat patients from 1 year to 90 years or 100 years. When asthma patient comes, they produce a lot of mucus. Virus, influenza virus, any virus trigger asthma, they end up in the hospital. But we do give our patients some prednisone or steroids, keep it at home. If they started having symptoms, they will start immediately, small dose, like 40 milligrams a day for 5 days. And we are able to prevent a lot of hospitalization. That we know. There is other cytokine like interleukins, L4 blockers are there, or cytosingulae are there, but they're not as effective as steroids.
Sure. Yeah.
So that's all we have it. Then we kept one of our allergists who treated his mother and father, and he gave steroids early, and mother survived, but father, unfortunately, they didn't give because he had diabetes. So within 24 hours, father has to be in the ICU. He spent himself in the ICU, and father he could not make it, unfortunately. Since then, he's having started giving asthma and the COVID patients steroids when they're early mockers. So he's able to prevent a lot of people not to go to the
Interesting.
hospital.
Interesting.
And then we came to know Dr. Ramesh, Mayur Ramesh in the Hendiford Health System has started a study from March last week and published now in the clinical infectious disease that steroids giving 80 milligrams a day, 3 days showed a benefit. actually
Interesting.
and they're able to. Now I have my friends, while learning about these conferences, some of friends are giving this IV steroids in emergency room, and some of them report there is nobody in the ICU in those hospitals.
Wow.
And the major concern is some of the steroids, some of the diseases, it can flare up the virus load, like
Uh,
contraindicated in chickenpox or
mm,
smallpox. But in the acute viral infection, we never had that. So we made a web conference Tuesday, which is on Aapi website. Everybody can watch that. It's on YouTube. Dr. Maduri from Tennessee, he's been experienced 30 years in ARDS and
mm,
steroids, and he also given almost 25 minutes of presentation. One of the obstacles we have is in WHO says steroids not to be given unless it is a part of the study. So that
uh,
so that's what the big obstacle. But
yeah.
we wanted to we after the meeting we decided to do an outpatient study. We wanted to do we just talking about the outlines. So if
Mm,
they can have these markers which I saw in Lancet, for
mm,
example, ferritin level and lymphocytes low and
mm.
LDH and other inflammatory markers they rise as early as 4 days.
So
And
the
if the number
markers are up in 4 days, like all the
yes,
inflammatory markers. Yeah.
and it is published in the Lancet. And if they
Okay.
are, and there is the line and the blue line, and the
Mm-hmm.
red line are the ones who died. So
Wow.
you can
Yeah.
able to predict in fourth day. Because we're talking to all the 10, 15 specialists, and so why can't we intervene them at that
Mm,
time with a small dose of steroids? Is the thought process.
mm.
And one of our patients we closely known, and they took chloroquine. Maybe that's the reason they did not get ARDS in eighth day. It got 12th day infiltrate. Then they called us and we said, okay, 80 milligram prednisone. The fever is not responding to Tylenol even 2 hours.
Even
It's
to.
coming back.
Mm,
And then pulse rate is very athletic. 60 go to 90 is not responding. But
mhm.
as soon as you give 80 milligrams, within 6 hours, the pulse rate normal, temperature normal,
Amazing.
rest is the history. So it's
Wow.
amazing response. It's only one patient I followed, and but the other ones Dr. Anya followed has a similar story. So it's worth to look into that as an
Yeah.
outpatient. We personally believe it is COVID may be an outpatient disease. Maybe we have to control.
Yeah.
The
So do you think it'll become like influenza eventually, like
I have a
outpatient?
feeling with this study, with what we know next month or two, as we go patients, we're going to start more and more. We were talking about if we can able to study and then able to publish, and
Mm,
we've started already awareness of them to the doctors. We send a one question survey after our video meeting. So,
mm.
yeah, do you consider steroids? Yes, no, or you need more data?
Yeah.
So we're sending that. We're going to get that one too, and we're also at the same time we're trying to represent through maybe through this webcast, maybe ICMR can look at seriously. We're
Yeah.
approaching our channels,
Yeah.
and if they can able to outpatient study within a month or 2 months, we can able to see. That's
So
what our hope. That's what I'm thinking here.
no, that's actually very interesting. I hope people are when they're going to hear that they can reach out to you and talk about and through API how we can educate people of using steroids. How do you think about the steroid intake versus antiviral versus chloroquine versus a vaccine? How do you how
Okay.
do you how do you see that?
Well, vaccine is definitely ultimate goal. So we
Hmm.
will. The experts are doing this. Several hundreds of doing. So we'll leave them alone. They are experts.
Yeah.
And coming to the see when the virus implicate, that's not giving our symptoms. These
Yeah.
clots, these are endothelial inflammation. So the clots are coming. Then the heparin need to be given. So if it is epithelial disease itself, we're okay. When it's going to the endothelial and the vasculitis and everything, then it's very very hard to
Very
treat.
challenging. Yeah.
It is so easy to treat early, and the amazing response in these patients is short dose of steroids, oral steroids, temporary steroids. The amazing. I'm hoping and praying that maybe the solution here, so we can
Yes.
able to. That's what I'm hoping, and we will be able to have some solution until we get the vaccine.
Yeah.
Compared to the virus antiviral like remdesivir will help the. Depends on when you give. Are you going to give remdesivir everybody? Obviously,
Yeah.
supply and demand.
No.
Are you going to
Right.
give remdesivir whole country of India? No. Are we going to give the IL-6 blocker? Because cytokines are multiple cytokines, so many chemokines. If we block
Yeah.
one, we don't know what else others do. How
That's
about
right.
early and as you know, inflammation, the mother of all anti-inflammatory is
Yeah.
steroids
Yeah.
in the lower
Yeah.
dose. And
So
I keep.
what are the challenges of using a steroid then? Like why people? I mean, if you are saying we are generating data. Why are people not adapting steroids that much in outpatient or like treating?
I think there is a lot of scare worry about. We know a lot of side effect of steroids in the long
Yeah,
run, so
yeah.
that's in their back of the mind. So we have to pursue them. We have to tell them cases like the same patient who is a physician who took the prednisone. He waited 2 3 days to take the prednisone, even though he's a physician.
Oh
So
my God, yeah.
yeah, he needs 3 4 people telling them. He talking to everybody. Some give that, some give other one.
Mm.
So it is our experience. Maybe we are in different treatment plans and they are different. They
Mm.
might have seen one case, but I still looking for any basic big time research article out there
Mm.
in this kind of coronavirus or a influenza virus early on given inflammation going up. There is a study on transplant patients. Steroids increases the viral load, but that patient is a different patient. Um, but we have given respiratory RSV infections. We
Mhm.
give 1 year old, 90 years old steroids.
Mhm.
They do
Yeah, so you
amazingly
still
well.
be able to get a basic results.
Yes,
Yeah.
and we have in this team, it's not mine. We have another allergist who himself immunologist. He's
Hmm.
spent 48 hours in the ICU with his father. He
Hmm.
knows he practiced a lot of immunology. We
So it's a
started.
great case study. Have you published that case study, that physician case study already?
Well, I don't know. It's one case, right? So I have to ask him whether he's independent. How he can, maybe anybody can letter to the journal. I will ask him to do. In this team, we're not one allergist or myself. And there's a pulmonologist we're asking, and we have infectious disease doctors are there. We have team of doctors working together. So we'll hopefully will make something. We're trying to take it out. Please look into that. There's so many studies doing. There's nothing wrong here. Please do the survey. If NIH thinks that it will be done in 2 minutes,
Yeah.
and we're
So
requesting
the
them.
idea is to create awareness that along with antivirals and possibly, I don't know about chloroquine, it's debatable. The data is actually debatable. Some say yes, some say no. It's kind of hard to say. And then, what do you think about chloroquine? Like we talk
Okay,
about it.
I can for chloroquine is only for first 4 5 days. Once you have the inflammation going on, once you have infiltrates going on, I
It
don't
doesn't
think
help.
chloroquine. It never be proposed like that. Prophylactically, there is some role. It will actually dampen the disease. It won't stop it if it is
Yeah.
minor. Because some patients I know anecdotally they did well, but they're a little bit younger too.
Yeah.
This in Michigan, one 80 years or older, 1 in 3 died.
Wow.
70 to 80, 1 in 4 died. Accordingly, you can go into the Michigan State data.
Wow.
So maybe we have a plan, military plan for all the nursing homes. Check the fever, we have COVID, get the blood test. If the markers are there second, third day,
Mm-hmm.
take the steroids and see what happens. We have to be proactive and watch that. And if you focus on all the nursing homes, 80% of them, we can able to contain there rather than waiting. But
Yeah.
unfortunately, our system, ER doctors goes there, oh, you have pulse ox is okay, you can go home.
Mm-hmm.
But I think we're proposing it doesn't cost much. We have
Yeah.
one telemedicine, we get PA, we get protocols, we can institute across the state. That's
Yeah.
what we're going to writing a letter to governor and our COVID team task force.
That's amazing. That's really helpful, and thank you for sharing with us such great data and insight on that. Before we go, first of all, I want to. It's an honor to have you, and you're doing such a great work at Aapi. So hopefully, through Aapi, through the word, you will be reaching to coroner and possibly the task force, and they can implement and add steroids in their regimen of treatment. Any message for the viewers?
Um, um, do we have to this? I mean, I will share my experience. What I learned through the epidemiologists, they are saying it is up to 50% of people has to get it before it will go. It is a long-term one.
Yeah.
So protect your elderly. Protect your elderly because what cases again and again. Sub youngsters came, the grandparents, especially in India. You take care of the grandparents, and even here, most of them they are the high risk, 60 above, are the numbers I just stated. Take care of them. That doesn't mean that you should, when you have the disease, don't afraid to call the doctor. If you have the problem, talk to go to the ER. It's safe to go there. ER rooms are free. So when you have it, even 1 year old, 15-year-old, 30-year-old, don't wait. You go there. Well, I think it can be not many people are going to the intubations now. They're learning more. We have more other treatment options. Don't be afraid. And if you have any, if you're out like a person who go out and work, keep your parents elderly in a separate and isolated, because that's very high risk. That's why you give your love, you protect yourself. That's what we have saw that. That's what I
No.
wanted to give the message.
No, thank you. This is a great message. Protect your elderly, protect yourself, practice social distancing. And it's just save yourself with that. So thank you for. It's a great honor to have you on the show, and thank you for doing a great service that you're doing through Aapi. We really appreciate that, and hope again. Thank you again, and hope you keep safe. And thank you for all the information
Yeah.
you provided.
Okay. Thank you so much. Have a safe day, and
You
thank you
too.
for giving this opportunity for me.
Of course.
Okay.
Thank you. Good
Bye.
night.